is going on? Hapana, we are on. Sema wenyewe.
Hello, good afternoon, good morning, good evening, everyone. We'll just give it a few minutes, just in case there are still any more people joining. So 2 minutes and we'll be starting. Thank you. Okay, I think we are good to start. Good afternoon, everyone. Good morning, good evening. My name is Pamela Chisanga. I work for WaterAid in Zambia. I'm country director for WaterAid here in Zambia. And I'll be your moderator for this event for today. I am sitting in Lusaka. It's raining quite heavily here in Lusaka. It's been raining since morning. So apologies if we have some internet disruption. I may drop off, but we have backup plans, so do not worry, the event will continue. So just giving that as an advance warning in case I disappear from your screens. The theme for this particular event is 1 billion reasons to build back better towards inclusive and accessible WASH. This event or this meeting has been sponsored by WaterAid, UNICEF, Sida, World Bank, IDA, HelpAge, and apologies if I mispronounce this, SHIVYAWATA and HURWID. We have a very interesting lineup for the event today. We have a panel discussion, we have videos, but also you have an opportunity to participate in the event through the chat box. So if you have any questions or comments at any point during the discussion, please do feel free to drop your comments or your questions in the chat box and we will attend to them at some point. If we are not able to respond to all your questions or your comments during this meeting, we will ask the different speakers or whoever you address the questions to respond to you directly. So please do feel free to drop in your questions and your comments that will be useful for all of us. So just in terms of logistics, we do have sign language interpretation. So because of that, we'll be asking all of us to keep our videos off when we are not speaking. So we'll ask you to turn on your videos only when you are speaking. Please do remember to mute your mics when you are not speaking and to only unmute when you do speak. And for everybody's information, this meeting is being recorded. If you do have any questions or issues with the recording, please do let us know again via the chat box if you have any concerns. At this point, I think we will be going straight into our discussion, but maybe just to also add in terms of the objective of the meeting, we are really here to influence us as WASH sector actors to ensure that we have disability, inclusion, and working with elderly people or older people in mind when we are developing our programs. Now, we might be thinking that we are preaching to the converted. Having worked in the sector for many, many years, I do know that this is easier said than done. We often talk about inclusion, but when it comes to actual implementation, we do struggle quite a bit in terms of ensuring that our WASH programs are inclusive. And when we talk about inclusion, we are talking about including everybody, people living with disabilities and elderly people as well. So we want to remind ourselves of what we need to do to ensure that our programs are inclusive. And to do that, in the meeting with us today, we actually have people that are living with disabilities who will talk to us about the challenges that they experience in accessing WASH, and who will also give us some insights into how we can improve our programming around inclusion as WASH stakeholders. So it is a very exciting event, given the lineup of speakers, but also this is an event that is held annually, and most of the people that will be talking or presenting during the course of this event have been in this meeting before. And so we are still simply continuing the conversations that we have already started and looking at how we can make things better, especially given the context that we are in currently. With COVID, we know that the people that are mostly impacted in terms of access to WASH services, it is the people that are living with disabilities, the elderly. They are having to cope with additional challenges in terms of access to water, sanitation, and hygiene. I was just reminded of this yesterday when I walked into a shopping mall, and I saw that in terms of the requirement for hand washing when you go into any shop in most of our shopping malls in Zambia, the kind of facilities they have for hand washing are not really friendly for most people with disabilities. So in terms of accessing some of these premises, it's increasingly becoming a challenge for people with disabilities. So we have to think about how we can build back better and ensure that people that are living with disabilities, the elderly people, are not left out in terms of accessing WASH services anywhere and everywhere within their homes and in public spaces. To start us off, we have David Lima. David Lima is a senior policy specialist on WASH at Sida. He will be giving the introductory remarks for this workshop. I will take you through the rest of the program as we go on, but let us start off first with the introductory remarks from David. David, over to you. Thank you.
Thank you, Pamela. Please give me a nod if you can hear me.
We can hear you.
Yeah, great, thanks. So good afternoon and good morning, good evening, I guess, for some of you. It's a pleasure to be here with you today and taking part in this workshop to build on last year's seminar, of which one of the objectives was to ensure people with disabilities are helping to define WASH priorities and approaches. So building on this, the objective today is to make sure that there is adequate representation of persons with disability in the Building Forward agenda for a truly disability inclusive programming. So even with the improvements achieved to date, large inequalities persists, and many persons with accessibility difficulties are among groups still to be addressed. The world has changed with the emergence of the COVID-19 pandemic, and this last year has been a stark reminder on the importance of safe water and hygiene and sanitation facilities, and its vital role in preventing the spread of diseases. So particularly at risk from the pandemic, and I think Pamela already mentioned this, are people who are older, sick, or disabled, but also people generally living in poverty and marginalization, and people who have limited access to healthcare services and water, sanitation, and hygiene. Obviously, everybody should have access to these services and facilities, but we know that that is not the case, and especially so for people with disabilities. Not only should people with disabilities have access, it is theirs and all other people's human right, and it's also a prerequisite for reaching SDG 6. Today, 1 billion people, or around 15% of the world's population, experience some form of disability. Disability can take many forms, including mobility and physical impairments, brain injuries, diminished vision or hearing, cognitive and learning disabilities, psychological disorders, and mental health issues. People with disabilities experience comparatively lower educational attainment, lower employment rates, and worse living conditions. Disability has a higher prevalence in developing countries, and disability increases with age. In addition, people with disabilities, older adults, and those that care for them often have a greater need for WASH services. Also, inaccessible WASH infrastructure puts additional complexity to menstruators with disabilities to ensure their hygiene and reproductive health. So, ensuring rights and access to water, hygiene, and sanitation for people with disabilities will enable them to fully exercise their right to participate in the society, the right to education, health, and work. Rights that can be practically restrained as long as there are no accessible alternative to safe and adequate WASH services. We also have to recognize right to equal treatment, which means that all persons be treated equally before the law, without discrimination, which in the case of not fully thought through WASH services is the result. Sida will continue working together with partners in combating discrimination in all its forms and highlight the importance to recognize the special needs and the vulnerability that people with disabilities have, ensuring that no one is left behind. There is also an important overlap between poverty and people living with disabilities. By addressing issues of accessibility, there are significant opportunities to free potential in regards of poverty alleviation. So, thank you for joining today's webinar that we hope will enlighten us on the meaningful participation and leadership of persons with disabilities and how their representative organizations can inform quality and equitable WASH policies and programs. We look forward to today's program, which we hope will enable organizations to deliver on commitments and ambitions to assure accessibility and build back better. So thank you, and back to you, Pamela.
Thank you so much, David. I think a few pick-up points from your opening remarks there, David. I think it's what you say about ensuring access to WASH by people with disabilities and elderly people actually also unlocks access to other rights, such as education and health. That's very important. We often forget that, and we tend to think about these rights in silos. So that is really important for us to think through as we continue with the conversation. I think in terms of the broader context, the bigger picture of poverty as well is important for us to recognize that a lot of people that are living with disabilities and elderly people also are living in poverty. The majority of them also will tend to be people that are living in poverty. And so we also have to take that into consideration. So thank you for those introductory remarks. I think they have given us, a good start in terms of the conversations that we will have in this event. If you have any issues of translation or interpretation, please do let us know in the chat box. For now, we move on with our program. We will be watching a video shortly. This is a video that has been done by UNICEF, WaterAid, Amplify Change, and IDA. The video has a number of people from across the world that will be telling us about the challenges that they face as people with disabilities or elderly people in accessing water, sanitation, and hygiene services. They will also be telling us what we can do to make access easier and better for people with disabilities. For now, enjoy the video. Thank you.
Local experiences for global learnings on disability inclusive WASH. Aya Agabi, Accessible Jordan.
The biggest challenge that people with disabilities face in accessing WASH units in Jordan, first of all, it's the lack of availability of them. Many spaces don't offer accessible WASH facilities for people with disabilities. And then another issue is that when they are available, there's no actual access from the outside to get to them. And so people aren't able to use these WASH facilities and then end up sometimes not being able to go out. And that's something I have to deal with every day, where I have to plan my entire schedule for the day based on when I can be able to get back home to be able to use an accessible WASH facility.
George Mumbi, Zambia Agency for Persons with Disabilities.
Major challenges that persons with disabilities face is the design and the distance from their home to the water and toilet facilities. Most of these water facilities, they are not user-friendly for persons with disabilities. For example, for height, like if you look at the issue of boreholes, you find the tap, the height, somebody in the water may not access that.
Nalule Juko Safia, Human Rights of Women and Girls with Disabilities, Uganda.
When you go to, especially the slums, where persons with disabilities, because of poverty, they can manage to live in slum areas. Most of the time, the slum areas are swampy places, and the toilets are high. One has to climb the stairs to access the toilets.
Atif Sheikh, Special Talent Exchange Program, Pakistan.
Still in our country, we don't have in-house toilet facilities, water, drinking water facilities, tap water, running water facilities in rural areas. So these challenges which are faced by persons with disabilities are doubled in rural areas. And second, like people with disabilities have a kind of a social stigma which enable a social barrier, wall of social barrier to access these facilities for them. And again, when we talk about intersectionality, for the women with disabilities, it becomes more complicated to access these facilities in developing countries like Pakistan.
People with disabilities are still seen as being sick or dependent and aren't seen as equal members of society, so people don't have any expectations of them of being able to go to school, work, live a normal life. So people just think that they're meant to stay at home and not do anything. That way of thinking stops people from even thinking of making their spaces accessible and having all the facilities that a person with a disability might need.
A large number of children with disabilities are out of the school just because they don't have accessible toilet in the school. They don't have toilet facility to go in the school, they don't go to school at all. People with disabilities are died in a very young, early age just because not having to access to the toilet. They stop drinking water because they can't ask their siblings or parents or family members to take them to the toilet all the time. For persons with disabilities, it's a big issue. It's a matter of life.
What can you do to strengthen inclusion?
There are several challenges are available at the policy level and the practical level. So first thing, we need to create the awareness about the importance of accessible water and sanitation. Second thing which is important to do, big organizations should implement, whatever project they implement anywhere in the world, they should consider the perspective of disability within the project.
In whatever they are doing, there should be inclusion, consideration in terms of budgeting, in terms of resource allocation around that activity, focusing on persons with disabilities.
It should not be a exclusive project for person with disability, exclusive activity for person with disability. But whatever they are doing, it should be inclusive for everyone.
The organizations of persons with disabilities, they are also passionate about this issue, and it will be very important that all people involved in WASH projects make strategic partnerships with these organizations.
Whenever someone is trying to make a space that is inclusive or wants to, always consult people with disabilities in the design process, because a lot of people have good intentions and they think that, oh, we'll just build a ramp, for example, but they don't know like what the specific inclination should be, like what needs to be added to the ramp, so they end up doing it wrong. So then it doesn't benefit anyone when they do that. So consulting people with disabilities in the process will help get the best results when trying to make a space inclusive for everyone.
Produced by UNICEF, Swedish International Development Cooperation Agency, WaterAid, Amplify Change, Human Rights of Women and Girls with Disabilities, and the World Bank Group.
Okay, that was an interesting video. Please, even though we do have specific panelists and presenters, let's make this a conversation for everybody. Any thoughts, comments, or feedback that you may have on the video, please do post them in the chat box. I think that will be useful and interesting for all of us to look at. So the next sessions that we will have, we will go into a conversation. We have a panel of people that will be talking to us. And from there, we will then move on to presentations, and we will have 2 presenters in that slot. So for our panel conversation, we have an apology. We were supposed to be joined by Honorable Safia Nalule Jackie, who is Member of Parliament in Uganda and is a disability rights champion. She is not able to join us today because of connectivity issues. However, we will still have a very lively discussion. We have 3 other people on the panel. We have Jonas Lombargo. Apologies, Jonas. I hope I pronounced your name correctly at the end there. Jonas Lombargo is the Secretary General of SHIVYAWATA, which is the Tanzanian Federation of Disabled People's Organizations. We also have on the panel Kelly Ann Naylor, who is Associate Director for WASH at UNICEF. And on the panel, we have Shaliu Tena. Shaliu Tena is a Special Olympics athlete, and she is a gold medalist. Shaliu is also a business person, I understand, from our conversations. We did have a very interesting pre-meeting conversation. So these are the people that we will have on the panel this afternoon, morning, or evening, wherever you are. Jonas, Kelly, Shaliu, welcome to the conversation.
Pamela.
Hello, Jonas. Yes, I see you.
Yes, thank you. Thank you for
Kelly
the work.
Ann.
Hi, everybody. Yeah, good morning from New York. A great pleasure to be here.
Good morning. Shaliu, are you with us?
Yes, I'm here. Thank you. Good evening.
Okay, great to have you. So let's start off with this conversation. So I will start with you, Jonathan, but this is a question really for all of us, for Kellyanne and Shaliu as well. But let's start with you, Jonathan. In view of COVID-19, as we have heard already from David, people that are living with disabilities and the people that you work with as an organization have had particular challenges in accessing basic social services, including COVID times. I just want you to share with us in terms of impact, what has been the impact for people living with disabilities on access to WASH services?
Thank you so much, Pamela, and the rest of the panelists and the previous speaker. My name proper is Jonas Lombargo from Tanzania. I am the Secretary General for the Federation of Disabled People's Organization. This is an umbrella which is bringing together different disabled people's organizations. We have about 10 of them, and many others are looking for enrollment into the federation. So to go straight to the question you posed, Pamela, I would say, first of all, I must point to the fact that this sector, WASH, is quite new to most of us in Tanzania, especially we in disability. It's a new, so we don't know much. We are not yet engaged in it, and it has not been part of our advocacy work, which we have been conducting since 1992 when the federation was formed. So we are still eager to know much and get more. So now in that context, when we know so little about WASH, there came the COVID pandemic, which required the proper use of WASH facilities, access to water and sanitation, and the use of other protective gears so that someone is safe from the pandemic. So we suffered a lot from infrastructural challenges where most of the facilities for WASH were not accessible, like other people has pointed out. And in some other areas where there were facilities, they were not that much accessible. They were a bit high, so that people with, for example, of those with physical disability could not access. They are high. Some were not even user-friendly to operate, so that you are able to wash, properly wash hand and remain safe. And some of them were not even designed specifically to be used by everyone. And some of them were even placed in areas where space were so narrow, someone on a wheelchair could not go into that. And so then we started our advocacy to address those issues. But also, you know, previously, like I could point out, that it was not only the issue of COVID, but people with disabilities have been left behind by so many programs and interventions that are established at country level and sometimes at international level. We are so far behind because as everybody is aware, we usually suffer little involvement, and most of the time at design, we suffer lack of specified facilities that are designed collectively to be used by people with disabilities. We suffer poor cleanliness and hygiene, especially in public. So you go for wash, you end up be contaminated by the wastes of the last user. Sometimes we suffer little focus when it comes to issues of girls and the women with disabilities, because usually they have extra and specific issues to be addressed. And here we consider different types of disabilities. When you talk of someone with mental health or someone with developmental disability, you find for him or her quite challenging for them to to use the facilities that are there. And they will also suffer management of their body hygiene and all that. And again, the tradition has been that even in our educational systems, we don't have anything in schools to address people with disability when they are young. We don't have clubs, we don't have groups, we don't have social groupings that could help to avail their social interaction where they could exchange ideas about WASH and all that. And for children with disabilities, also we miss out. We don't have the child-friendly WASH things like reading, like awareness materials that would make children understand and grow with information about WASH. And for everyone with a disability, even this information available is not even produced or presented in inaccessible formats. So you find the problem becoming so big and big. And then you find it now, when you bring it in the context of COVID-19, with all this I've said, then the problem becomes even more and more complicated. So in record, it happened that we had only one death for someone who were in our board of SHIVYAWATA. We don't have records of anyone with a disability else who died in Tanzania. Though the problem in Tanzania is so low now, we don't have a big threat with COVID-19, but we have to remain prepared so that we are protected against COVID for anything like second eruption or whatever comes thereafter. So this is a response to your question, Madam.
Thank you so much, Jonas, and sincere condolences to you on the loss of your board member. I will get back to you, Jonas, because the context that you highlight is quite interesting. And when you talk about WASH being a new issue, a new area for people that are working with disabled people's organizations, you could say the same thing also in Zambia, which is really strange given that WASH is so important and critical for everybody. So I will get back to you in terms of the specific context of Tanzania and some of the things that you have been doing to address challenges of access to WASH in view of COVID as an organization. How have you been supporting your members and people living with disabilities? So I'll let you think about that as we move to Shaleo. Shaleo, how are you?
I'm doing good.
Doing good, good to hear. So the one question that I have for you, Shaleo, is how did COVID-19 affect access to hand washing for people with intellectual disabilities? And if you can share with us also just how it affected you personally, just under 2 minutes.
To me, it has not affected me because we have water for drinking, things that like tap water for like washing hands when you go to the washroom, simple things like drinking, but it has affected other people in low income, like in my shags, it's Transmara. People like with disability can't walk to places like water. Some of them don't have like a tap of water in their own houses. So you have to go to like 4 or 5 kilometers more or even more to get a place for drinking water. So they have to like be brought for water or they have to walk to there. Like they should be given also masks and all that. Then I volunteered in a place called Kangware, like a slum, like a kijiji. I volunteered there, I think for 1 year. The people, some of the children never had like wheelchairs, so the parents had to carry them for many kilometers because some of them don't have fare. come there because they used to be given, sometimes they used to be given like prayer. So now the scenario is like you have to, like they carry their own children, and some of inside there don't have washing hands, like water, things, simple things like water. So they have to carry like in a jerry can to bring water there. So they carry water, their own children, and some of them have to carry like food for them. So it's like hard for them to carry it. Yes. Thank you.
Okay, thank you so much, Shalil. So maybe another question for you, Shalil. What must we do to make WASH inclusive to people with intellectual disabilities?
We can give them places to wash their hands. Like if you go to malls, like some of the places that you use sanitizer, some of them are too high for them. So they have to like reach up to be given or something like that. And they to given. So, and to give them water to be for them to shower. Some of them don't have water in their own houses. So even to shower or to brush hygienic, some of them don't have access to water to do such stuff. So they need to be given, even to make it free sometimes, because water can't be expensive some places. And yeah, and some of them like to be given masks, because masks are usually very expensive in where I live, because some of them don't have jobs. Very few people with disability, because some of them may have wheelchairs, they can't go places, like work has to be very far. So they should be given like a mask and all that. Yes. Thank you.
Okay, thank you so much, Shalil. We move on to Kellyanne. Kellyanne, welcome again to this panel conversation. I just want to hear from you how UNICEF has reacted to the changing environment while also keeping the focus on making WASH disability inclusive, just paying attention and not losing the focus on disability and inclusion. What are you doing, or what have you done as UNICEF?
Thank you so much, Pamela. And it's just, as I said, such a pleasure to be here, and just, you know, looking across the participants to see so many dear friends and colleagues coming here as part of this partnership. So I think just, you know, kind of bringing it back to UNICEF being the United Nations Children's Fund, our entry point really on this issue is fundamental to the core values and the mission of UNICEF, and really helping all children to be able to realize their rights as are outlined both in the Convention on the Rights of the Child, as well as the Convention on the Rights of Persons with Disabilities. And I think, as both yourself and David really pointed out in the opening, access to water, sanitation, and hygiene really unlocks so many other rights for children, education and health, as well as just fundamental aspects of our well-being for social inclusion and dignity. So looking at this kind of changing context, and I think Jonas and Shalal really pointed out that this COVID-19 pandemic has really shined a spotlight on the pre-existing gaps in availability of services, in the access to services, and also the affordability of WASH services and products, whether it's at home. And I think lockdowns have highlighted that when we don't have access to water and sanitation in our homes, this is very problematic. Also, healthcare facilities, and just next week with the World Health Organization, we're going to be releasing a report that will indicate that less than 40% of healthcare facilities globally have access to basic sanitation with at least one accessible toilet. So in a pandemic where we're looking at a health response, we see that healthcare facilities are not accessible. Schools, also, I think it's been highlighted around public spaces. I think, Pamela, you were talking about the fact that some of these hand washing devices have not been mindful of different types of access issues. So these are all very much, in some ways pre-existing issues that now have become, a matter of, and yeah, very much kind of a life or death or a health issue. So I think for us, and I just wanted to share again, kind of putting it into context that, when we look at this pre-existing condition, I think it's estimated that around more than 1 billion people globally are estimated to have a disability, and UNICEF estimates that 10% of all children may be affected by a different types of disabilities. And based on this, we estimate that approximately 110 million people with disabilities may be at risk of having poor access to water, sanitation, and hygiene. And I think this just shows kind of the scope and scale, and is also really a call to action for all of us who are trying to close the gap on access to wash with a principle of leaving no one behind. So I think now kind of pivoting to what UNICEF is doing, I think most of all, we've tried to continuously make sure that inclusive wash services are a part of our strategies, our plans, our budgeting. Internally, we have directives that require that all new program related activities apply principles of accessibility and universal design. So really everything that we're doing, whether it's development or humanitarian, is within our organizational structure mandated to be inclusive and universal design. I think maybe specifically coming back to the COVID pandemic itself, I think we've really had two angles on the work that we have been doing. We have been trying to look at this response, as I said, to try to, particularly in hotspots where we have outbreaks, to be able to provide emergency services to populations that may have poor existing access to water and sanitation and hygiene. And also really looking at the design of some new types of products and services and hand washing devices that can be mindful of different types of accessibility issues. We've also been, so that's really on the side of trying to stop the transmission. We've also been very active on the communication side. I think a lot of times we think about wash facility access, but I think it's also been really important that people have access to information. So there's also been a strong focus in UNICEF to make sure that information on prevention measures and hygiene practices, issues like social distancing, are also provided in a way that can be accessible to different types of disabilities and different formats. And then I think the second part of this has been, and I think we've all seen that it's not only the pandemic itself, but it's also been the socioeconomic impacts of the pandemic and the response to the pandemic. So we've also been looking at tracking disruptions in services to identify areas where existing wash services might be interrupted, and also looking at tracking affordability. And we've seen, for example, in countries like Chad and other countries, we've seen rapid increases in commodities like soap. So I think as we were discussing about the issue linking also issues of poverty and income availability with also the impacts of COVID-19, that we do need to also be looking at this issue of affordability and how social protection systems can make sure that that we can continue the economic access as well. So these are some of the things that we've been doing specifically on COVID-19 in addition to our regular program. Thank you.
Thank you so much, Kellyanne. We have very little time remaining in this conversation. The theme of this event is 1 billion reasons to build back better, but I'm going to ask you just for one reason, or maybe if one opportunity that you see for us to build back better. So for both you, Kellyanne, and Jonas, just give me one reason, one opportunity, that you see for us to build back better to ensure that we include people with disability, elderly people in accessing WASH services. And for Jonas, I think there was a question earlier for you in terms of what you have done specifically as an organization to support your members and people with disabilities in Tanzania, given the context of Tanzania, where probably there is no national response plan for COVID, but you are mindful of the context that you are in, and you want to support your members, I'm sure, to prevent contracting, to ensure that they don't contract COVID. So under a minute for both of you. I know it's a very interesting discussion. Looks like we have just started, but it's already ending. So I'll ask you to just briefly give us your responses in under a minute each. I'll start with you, Jonas. Thanks.
Thank you. Thank you so much, Madam. I think what we did was to plead to stakeholders and the government to develop the guideline on how the health service personnel could manage the people with disabilities who are coming to the camps and who are released, that they are free now from COVID, back to the community to address issues of stigma. And the other stakeholders also developed accessible hand wash facilities which we distributed to different organizations. So at every door of the DPO, at least they had a bucket, and we had sanitizers and everything of that. We managed it by also promoting use of African tropic sour fruits like lemon and oranges and ginger, which has helped even the country to at least manage the problem, to not contracting as many people as possible like it happened in other countries. So my suggestion to the opportunity that I see, because I believe in partnership building, and in partnership building, you see, we'll need the capacity building to partners who are working in the sector of WASH, so that they are able to articulate and involve people with disabilities in their programs. That also calls for strengthening of the advocacy units that are in the WASH stakeholders, because they have advocacy units, but they're not properly dealing with advocacy, with the equity, with the inclusion. So we might need to work on that and make that those advocacy departments work in partnership with the DPOs, because these DPOs are the ones who knows better issues and challenges of people with disabilities in WASH, and they can also help to inform the advocacy units on how we can make this WASH a cross-cutting issue, or make it part of our advocacy work, because we are most focusing on other rights other than the right to access to water and sanitation. So we need that capacity building, that training, that skills development, access to information that is existing in the sector, the resources that are existing in the sector, so that we are able now to move together and to ensure that no one is left behind. And there's a slogan of the CRPD, which says, nothing about us without us. That will also be enhanced if we do the partnership and the collaboration between the WASH stakeholders and the DPOs who are working with the Federation. Yeah, thank you so much.
Thank you. Kellyanne?
Great, thanks. And I just really inspired by what Jonas said. I think very much, I think my kind of takeaway from this is the importance of the engagement and participation of persons with disabilities as central actors and experts in our WASH program planning and implementation. And I think whether it's disease pandemics, extreme weather events with climate changes, I mean, WASH services are going to need to be resilient, they're going to need to be affordable, and they're going to need to be inclusive. And so what I would hope that we could take out of this in terms of, you know, building back better or building better forward is really that inclusive WASH services are a norm for all WASH services. As we look at building up the investment cases for WASH going forward, and the partnerships that we need to build with health, with education, and with local governments to really make sure that WASH services are inclusive as we look ahead. Thank you.
Pamela.
Sorry, struggling to unmute. Thank you so much to the panel. Thank you so much, Jonas. Thank you so much, Kellyanne and Shaleo. Very useful and interesting input from all of you. I do take the call from Jonas for support, for capacity building, and to provide them with resources that they need to really also ensure that they have a focus on inclusive WASH. So that's a call to all of us stakeholders that are on this call and working in Tanzania. And indeed in other places, we might be assuming too much in terms of what DPOs know and don't know about inclusive WASH programming. So I think that call should be taken in all contexts for us to look at supporting capacity building, as well as providing resources that DPOs need to also push for an inclusive agenda for WASH. Shalio, I think your points on making water accessible to everyone and making hand washing accessible to everyone are well noted. And I think this is the best time to make that call for hand washing, for hygiene, in the context that we are in. If we don't win this battle now, I don't know when we are going to win it. So this is an opportunity that we should all seize, and we should all, you know, take advantage of and ensure that hand washing becomes a norm, as Kellyanne suggests. So access to inclusive WASH should become a norm. So we've seen a lot of designs of hand washing facilities. It should go beyond that. We need to look at all WASH services, water supply, sanitation as well. So this is the time for us to do that as actors in the sector. So thank you so much. Okay, so we will now move to our next segment. And we do have two presenters this afternoon. So for this segment, we will have Ilam, who is an advisor at IDA, International Disability Alliance, and Diane Hiscock, who is from HelpAge International. She is the Global Disability Advisor. We will have Charlotte coming in at the end to give us her closing remarks or a closing presentation. But for the next few minutes, let's listen to the two colleagues who are going to be talking to us about how important it is also to think about the elderly people. I know that a lot of the times when you talk about inclusion, we often don't think about elderly people. And in terms of, programming for inclusion, particularly for disability, inclusion for people with disability, there are a lot of things that we assume, and we already heard that from Jonas and Shaliu. They gave us some examples or some insights into some of the challenges that they face. So we will hear from IDA on how we can address some of these challenges and how they have been working on some of these challenges. And from Diane, she will also give us a perspective of how to address access to WASH for elderly people. So over to you. I think we'll start with Eliam. Over to you for your presentation.
Thank you so much. Yeah, can you hear me, Pamela?
Yes, we can hear you. Because it is a presentation, I think it would be good if those of us that have our cameras on, if we can please turn off our cameras for the presentation.
But you can also see me, I guess.
We can see you in the corner, yes, but we can see the presentation as well.
Okay, thank you very much.
Thank you.
Yeah, thank you very much. My name is Elham Yusufian. I am working with the International Disability Alliance. Our organization is actually an alliance of 14 disability organizations of persons with disabilities at global and regional levels, and then which by their turn they have like members. So we overall represent more than 1,100 organizations of persons with disabilities around the world. I'm working with the International Disability Alliance as the Inclusive Humanitarian Action and Disaster Risk Reduction. I want to take this opportunity to just highlight a little bit the right-based approach. I'm supposed to talk about what we can do to address these challenges. My magic key would be to take the right-based approach to the issue. And what do we mean by that? Very basically, if you look at the definition of disability in this context, we would see that disability is not just the impairment. So we cannot say people have like different types of disability. They have visual disability, they have hearing disability. People have impairments, and then what creates disability is not just the impairment, but when the impairment interacts with the society, with the barriers that exist in the society. And by barriers, we mean institutional barriers, environmental barriers, and attitudinal barriers. This is a definition that is included in the first article of the United Nations Convention on the Rights of Persons with Disabilities. So what creates my disability is my impairment when I am living in a society full of barriers, institutional barriers. In the context of WASH, institutional barrier would mean that when budgeting for WASH services, they have not considered disability inclusion in budgeting. When they're doing procurement, they have not considered accessibility as one of the checklists or checkpoints of when they are doing the procurement. So they are procuring, they're building inaccessible WASH services because they have not considered this institutionally, this commitment of being accessible. The environmental or physical barriers are pretty well known to everyone. For example, inaccessible WASH services for someone who uses wheelchair, not putting in place directions for a blind person so that they can use the WASH services independently and equally. And then I want to highlight the attitudinal barriers here, which is very important. And I think in the context of WASH has a very important role. So one part of it is the attitudes, the stigma in the society, which actually prohibits many family members not allowing persons with disabilities to use WASH services. Because like they would say to the person with disability, please, we don't want you to go out because people would make fun of you. And then also enhances the possibility of violence and abuse against persons with disabilities. which is actually another barrier for not using the WASH services, especially for women and girls with disabilities. So yeah, and I also wanted to highlight the importance of independent living, which is another aspect of looking the issue from the right-based approach perspective, because when we mean access to WASH, we mean independent access to WASH. Unfortunately, I have noticed that many people say, okay, this service is accessible because they're going to use their family members to support them and they use it, so this is accessible. By accessibility, we mean independent and equal use, right? Exactly as other people use it. And as of the right of independent living, I also want to highlight that it is important to have access to WASH in order to ensure independent living. You can't imagine how many persons with disabilities have to live in institutions and care facilities. And this is also the case for older persons. So many persons with disabilities and older persons have to live in institutions and care facilities just because they do not have access to WASH services. And then in terms of intersectionality, I want to use this opportunity also to talk about the situation of refugees and displaced persons with disabilities and older persons, those who live in humanitarian contexts and areas affected by armed conflict, in areas where disaster have happened, those who are internally displaced or refugees with disabilities and older persons in refugee camps, those who have to live in urban or suburban areas. And so when the situation of disability or being an older person intersects with being displaced and affected by humanitarian context, the access to WASH becomes even more compounded and difficult. For this purpose, we have I want to draw your attention to a very nice set of guidelines, which is the Interagency Standing Committee Iasc guidelines on inclusion of persons with disabilities in humanitarian action. These guidelines were launched last year in November 2019 in New York, and they include detailed recommendations, suggestions, and ideas like tips on how to ensure inclusion of persons with disabilities in different sectors. And one of these sectors is actually dedicated to access to WASH. So if anybody is working in humanitarian context, they can simply look at these guidelines and find that chapter, which includes lots of great ideas, including the barriers that persons with disabilities face, enablers, what to do to overcome those barriers, and do's and don'ts of accessible WASH. Yeah, and then the good thing about this Iasc guidelines is that they are based on consultations with persons with disabilities and their organizations. So within the period that these guidelines were drafted, actually, a number of consultations with persons with disabilities around the world, different groups, including people with from different constituencies, from different regions, have been working together to prepare these guidelines. So when we talk about consultation, when we talk about participation, this guideline is actually a good example of what has been produced based on consultations. And I want to end up here by highlighting again the issue of participation and consultation with persons with disabilities and their organizations, their networks. That we hear from many people that we cannot find organizations of persons with disabilities to consult with them or to work with them to make sure that they are participating. I just want to, my answer is that, first of all, please, one way that you can do is to reach out to national organizations, to regional organizations, and to global organizations of persons with disabilities. And they would most likely direct you to the local organizations of persons with disabilities with whom you can get in touch. In addition, in many contexts, especially in humanitarian contexts, there are just informal networks, peer support groups of persons with disabilities, which you can find out and consult with and discuss the issue and ask for their feedback and support. And this is not just something on the top to like for this will actually make the job much easier for the real inclusion and implementation, because actually it would save a lot of cost as well. Because in many cases, if you do pre-consultation, you will see that there would be a huge saving in terms of future costs, because considering accessibility from the scratch in pre-planning before designation is much more cost efficient than making something inaccessible back accessible. So I just wanted to thank you all for this opportunity and hand over to Diana from the HelpAge to continue this very interesting conversation, to tell us a little bit about inclusion of older persons. Diana, over to you.
Thank you very much. So let me just put my video on. So thank you very much. Just to build on what Alhama said, and just to introduce myself, I'm, as I say, Di Hiscott. I work out of the UK with HelpAge International, globally with our network partners throughout the world. And I want to really extend the thanks to have the opportunity to come on this platform. It's very important to us in our work that we promote the better access for older people and people with disabilities throughout this humanitarian crisis. So to build on the Iasc guidelines, we use a lot prior to the launch of the Iasc, the humanitarian inclusion standards for older people and people with disabilities. And if you're not familiar with them, there might be something to help build on what we've already been talking about, how to improve access. And I think they're very useful in the discussion because they do base themselves on the 9 core humanitarian standards, which we are all, if you're in the humanitarian sector, quite familiar with. And they basically run through the key areas which we need to assure inclusion is addressed. And it's not just about identification and safe and equitable access. It's all about building resistance, increasing our knowledge and participation, and making sure we have a system in place for feedback. And the coordination obviously is key to our work, to making sure, as Jonas was saying, how we make sure our DPOs and OPAs work with the WASH sector and strengthen that network. And then another important area, we need to reflect on our learning from what we're doing to make sure we do a better job. And that's something we often don't make time to do, isn't it? And that obviously goes with resources and with human resources and funding, as also mentioned. So I think it's a useful tool to maybe dig into a bit more. But if there's 3 takeaways to how to make inclusion happen a bit more effectively in our humanitarian system, it's these 3 points below. We must collect better information, and we must identify the communities using sex, age, and disability disaggregated data. Otherwise, we don't know who we're talking about, and the people in the communities are not given a voice to be heard. And likewise, we need to address barriers through this process. We understand barriers and find solutions together. And that leads obviously to much more effective participation and building resilience of communities by involving everyone to work together. Thank you. Next slide, please. So I think just to summarize a few points to reinforce a lot what's already been said previously. We know very well how important WASH activities are to our well-being, and to reinforce that it does improve, similar to what Elham was saying, we're also looking at protection and health and issues related to WASH, and it goes across all the sector. We also must recognise, likewise, the reverse. If we fail to have this structure in place to support inclusive sanitation and hygiene, we risk both protection and health. And it's clearly seen in COVID crisis how that's really been challenged. And so with using those humanitarian inclusion standards and the Iasc guidelines, it's a really good way, we find in our work, to make sure our needs assessments, our program design, our implementation activities, and our monitoring and evaluation has effective structures to address and challenge how we can be more inclusive. So it's again recommended. And with the continual engagement, that we have a two-way shared learning together, we see we get better results, because it's not easy, it's not straightforward, is it? So I thought I'd just look at three examples, three stories from some people we know in the field. Next slide, please. So I want you to meet Rabea, who comes out of Cox's Bazar in Bangladesh. And she tells her story. I'm 86 years old and I've been living in the camp for 3 years. And I'm sure many of you have been to Cox's Bazar, know what a pretty horrible place it is. And she struggles, she's telling us, that she get down those steps, as you can see there's a picture there with a muddy hill terrain. She can't get down to the toilet very well. Her legs are very weak, and she also is not being able to see very well. But she reflects, my stick is my guide, yeah? My family have gone for food distribution, so no one can get help for me now. I wish there was a toilet near my home. So we obviously have to find some solutions pretty quickly with that for her. So together, it didn't happen overnight, we discussed with Rabea and the community, and they were really surprised. They found others who also had not had their voice heard. And they were very concerned how to deal with it. And they put together a plan with very low cost to put in rails and some wooden steps to make things more stable, made the toilet handles easier to get open, and also raised the toilet. And that initiative made a lot of difference to that community. But still, it's a very hard focus. It didn't happen at the beginning of the project activities. Next slide, please. So then I've met Fred. So Fred, 55 years old, I use my wheelchair to move around daily to do my shopping. And in COVID time, he had a lot of trouble keeping safe in the community, as no one would help him due to the physical distancing rules. He was very impressed, there's a picture of him sitting in front of a water basin, but it's too high, and he couldn't actually reach the taps very effectively. As he said, it's no point having it here, it's not accessible to me. And he did question why they didn't think about this in the planning. So again, the challenge comes for what do we do next? So we basically, Fred talked with his peers. They worked with the engineers to adjust the height of the sink so that people who were shorter or wheelchair users could get access to the water tap. And they also changed the taps here from pushing to being lever, to be much easier to use. So again, it took a bit of time for things to go wrong before they became more effective and more accessible. And possibly now we have to try and reverse that and make sure it's accessible from the beginning. Another last story just to share, which for me is a very important area that we may not give enough attention to because it's very challenging. Because within HelpAge, we do link with a lot of very vulnerable older people with disabilities and without. So I met Victoria, who lives with her granddaughter. She's living with dementia. She spends her day in isolation, basically. And with COVID, it's obviously got worse. Her grandmother's severely malnourished, says the granddaughter, and no interest, no appetite to eat and drink. She's doubly incontinent and has no toileting routine. The room smells and no one comes to see her or the granddaughter. So as she relates here, she's very difficult to bathe and clean her homemade diapers, and she cannot communicate well. And the water only comes on every 3 days, which is common in Ukraine, isn't it? So solutions, well, it is a very hard one, and we're only at a starting point of finding solutions here. And we provided a toilet chair, put her bed near her bed, gave her extra water to wash, and some regular support visits. But we're only scratching the surface with Victoria's high level of needs. But it's important that we do take the effort to try and make sure we can address her WASH accessibility needs. So just wanted to reflect on those three short stories, because for me, in our work over COVID time, I'm very concerned that when we're building back better, is social stigma and discrimination, which is something Kellyanne mentioned earlier also, is really something we need to address more systematically in our work. We see anticipated stigma. We see everyone's increased worry from all of us. We have perceived stigma. We feel judged by family and friends. And we see, sorry, got things coming over my slides here. Experience stigma, and we have internalized stigma. And this is leading, we can see a lot, to unintentional and intentional abuse in the care setting, which I think is something we need to consider in the planning for any future WASH activities, if we want to really make sure we leave no one behind. At that point, I'll end there and say thank you very much. A lot to talk about.
Thank you so much to both Iliam and Diana for very interesting presentations. Would have loved to spend a little bit more time interacting with the two, but maybe what we can do is in the chat box from Iliam's presentation. I think for me, what struck me in terms of barriers is the fact that not budgeting for inclusion is also a barrier. So I just want us in the chat box from those of us who are on the call, just indicate to us in the chat box if you do have in your budgets a dedicated budget line for inclusion. We don't want it's mainstreamed, it's integrated. If you have a very explicit budget line that we can see in your budgets, please indicate in the chat box. From Diana, I think your stories, the 3 stories, I found them really touching. Again, if you also have any personal experiences or encounters that would be useful for us to learn from, please do put them in the chat box. I will ask Priya Nath, if you're on the call. She has kindly grouped some of the questions and comments that you have in 3, just for her to read them out. We will not have time to interact with those questions or respond to those questions. But because the call is being recorded, I'm assuming we can always come back and look at responses that will be given by any of the panelists that will be responding to the questions in the chat box. We may have time maybe for just one quick response, but Priya, over to you very quickly, if you can take us through your clustering of the comments or questions that came through from the chat box.
Sure. Thank you, Pamela. So the questions we had from the audience, some really great discussion. The questions kind of fell into 3 different areas. One was around what the vision and what the good practice looks like at the moment. One group was around policy advocacy and evidence. And the last group, a very important group, was around school WASH. So the questions that came on are in terms of like good practice evidence. Have we seen any very good practice of disability inclusive and older people inclusive WASH work during this COVID that others can learn from? On policies and commitments and also evidence, people are asking, do we have any quantified positive impacts of accessible WASH? Is there any evidence that we can share with policymakers, and equally any evidence of how the lack of WASH is contributing to disability rates or ill health? And the last bunch around school WASH was around recognizing that accessible WASH in schools is often a blind spot, and that people are pushing back saying that there are no children with disabilities in this school. And maybe a question for UNICEF is, how do they respond to that in a way that targets that attitude? And maybe how do they move beyond the infrastructure, accessible infrastructure, to really making school WASH programs such as menstrual hygiene programs accessible for those with learning disabilities? But we will take all these questions away as well if we don't get time today.
Okay, so Kelly Ann, are you able to do 1 minute response? If you are able to give us a response in 1 minute, I will give you 1 minute to just respond to that one last question. But maybe the other interesting question on, do we have evidence of the impact of inclusion in accessing WASH services? I wonder if Diana or Iliam, you want to respond to that in a minute each? Kellyanne, are you there? If not, can we move quickly to Diana? In under a minute.
This is Diana, yeah. So inclusive WASH practices. There are many efforts have been made, and one I will say is from Ukraine, where the people had no water in the communities, and the volunteers managed to get them small containers, because the older people couldn't manage the heavy containers, and they would distribute them around the village and allow them to have water in their houses. Whereas before they would have to go outside to get their water from the wells, and obviously they were told to stay inside their houses. So that was one example, hopefully a short-term solution, but it's still quite challenging for people. That's one from me. Thank you.
Okay, Iliam, are you still on the call? Do you just want to also
Hello, it's
on
Kelly.
the comments? Oh, are you there?
Yes,
Okay.
I'm sorry. Yeah, I was trying
Okay.
to.
Sure. Go ahead. 1 minute, please.
Yeah, no,
Thanks.
I think this is really excellent. I think one of the things that we find is that we do. I think countries respond best to learning from other countries, and so we do have a series of case studies that have been, and Bissy can share these, that have documented a range of examples of how countries have implemented different interventions. And I think there, while there may be some that are emerging that are maybe specific to COVID-19, we have a guidance that was developed with our disabilities program that Bissy can share right now. But we have a long practice on WASH in schools, on WASH in healthcare facilities that we can share these practical examples from countries, because I think on one hand guidance is useful, but it's also really important to see how it's very much context specific and implemented locally. So I think those things would be available. I think there is an important area that's around the disaggregated data. And I think this is still an area that I think is a gap of being able to really make sure from both at the planning stages of programs, as well as looking at the monitoring, to make sure that really we are leaving no one behind. And I think this is also something where there's a lot of emerging practice on how we can be better at making sure that we don't assume that we're reaching everyone with our interventions, but in fact that's a reality. So I think I understood we'll be able to have some references, so we'll be really pleased to share those things from different country offices with the team here. So thank you so much.
Okay, thank you so much, Kelly. And Iliam, do you just want to respond 1 minute? Iliam, do we still have you on the call? Okay, if not, thank you all so much for participating. We still have one more speaker coming up next. After that, we will be closing the event. But at the end of the event, we have a video that we will be showing. So if you do have a few minutes to spare, please do stay on at the end of the event to watch this video that we will be showing you after the event. But for now, I want to invite Charlotte McCain Mlapo. She is the disability advisor at the World Bank. She will be giving us a closing presentation, a closing speech. And after that, we will be ending the session. So thank you all so much for your input, and please do continue commenting in the chat. The session has been really useful in terms of getting a little bit more insight into issues that we always think we know, we know everything, we are doing it. But for me personally, as a person who's been working in the WASH sector for some time, there are a lot of new things that I did, get from the different speakers, particularly our colleagues from the DPOs. I think they did share very good insights, and also from the different organizations, I do see that we have a wealth of resources for us to tap into to make WASH really accessible for everyone, everywhere. So I think what we need to do a lot more of is to share these resources amongst ourselves so that we can help each other in terms of inclusive programming for WASH, but also in building back better. I think that learning and collaboration with all stakeholders will be important so that we avoid duplication, we can maximize on the resources that we have, and we can tap into the wealth of resources that we have. So thank you, Kellyanne, for volunteering to share your information and resources that you have. I'll also kindly request that other organizations as well, the presenters that were here, as well as the panelists, and indeed those of us who are participating in this event, if you have any interesting and useful resources to share, please do post them in the chat. We'll be able to access them from there. So Charlotte, over to you.
Thank you very much, Pamela. And I really thank you very much for asking me to make some final comments. And I just wanted to first of all say thank you to our panelists for their time and for their valuable insights. I know that the water and sanitation sector has a long and well-recognized understanding of the importance of being inclusive and accessible. And I think this session today bore testimony to that fact. I would like to underscore the tagline of today's session by reiterating that, yes, there are at least 1 billion reasons for making water and sanitation accessible and inclusive. Today, we learned that the importance of not only building disability inclusive facilities, but also about the importance of including people with disabilities at every stage of design and implementation. This messaging also applies to older persons. We heard how the lack of accessible infrastructure hinders mobility of persons with disability, preventing them from accessing many public services, space, and very much impacts on their dignity. And this is particularly the case for those in rural settings. We heard about accessing adequate water and resources and how people access or do not access sanitation facilities. And I would say that this has become even more important with the COVID-19 pandemic in place. For all the reasons discussed here today, we know that the inclusion of persons with disabilities is essential for achieving the Sustainable Goal 6 on water and sanitation. We also heard that adopting a disability inclusive approach in the design of WASH facilities is both achievable and it can be cost effective. Allow me to expand a bit on that important point. While the data is limited, and we did hear from a few speakers on work that they're doing around costs, some studies suggest that the cost of inclusive school latrines is less than 3% compared to the cost of a regular latrine. A recent case study published by the Water Global Practice at the World Bank, with support of the Global Water Security and Sanitation Partnership, analyzed costs of accessible WASH using the PAPSIMAS project in Indonesia. And what they deduced from their analysis was both instructive as well as validating the point that when disability inclusive development is incorporated at the beginning of the activities, expenses are likely to be modest. And this point was raised by many of the earlier speakers. But let me give you an example. When the PAPSIMAS introduced the community-driven approach, the monetary cost of embedding disability inclusion in soft components of the WSS were 2.8 of the total soft costs. Similarly, with the hardware, comparing accessible and non-accessible hand washing facilities, the case study found that the accessibility option was only 1% more costly. And what does that do? Well, what it does is it dispels the myth that inclusion is too costly. We also heard from the speakers that we now have tools. We have tools that can enable us to ensure that our projects are more inclusive. Mention was made of the Iasc guidelines. So for me, a key takeaway from this session is that it is absolutely essential that when we design water and sanitation and hygiene projects, that we insist on including persons with disabilities, but that we also look at collecting better data and we keep the learning loop. We keep learning from what we're doing. I'd like to share with you an example of the bank's Utilities and Future initiative, which supports efforts to improve utility performance on a variety of dimensions. And one of these dimensions is the dimension on inclusion. And embedded in that has been the deliberate inclusion of disability. And it is really important for us when we think about disability inclusion to be very deliberate about it being embedded in projects. It is not sufficient to just have inclusion. It has to be explicitly disability inclusive. Another example that I'll share with you is from the water utility, is from Ethiopia, where we have a water utility that has included inclusive and accessible designs in nearly 300 public toilets and 438 communal toilets in low urban settings in Addis Ababa. These public toilets are operated by associations of persons with disabilities, as well as women's organizations, and they have provided income resources for these excluded groups. So in conclusion, I wanted to say that at the bank, we're steadily advancing the operationalization of disability inclusion. And this is evident in an increase of projects that now address the specific needs of persons with disabilities. For example, 25% of our new projects approved last fiscal year, compared to 13 the previous year, now identify persons with disabilities as an excluded group and include actions related to making sure that projects are more disability inclusive and accessible. But we can and we must do more. And I'm confident that this session will inspire WASH practitioners to work and engage with persons with disabilities as they plan, design, and implement water and sanitation projects, and really make this the step in the right direction towards building back better. So again, thank you for an excellent session. And with that, I'd like to hand back over to you, Pamela, to close us out.
Thank you so much, Charlotte. Indeed, we must do more and we can do more. We have a billion reasons to do more. And each one of us, if we just put in even one reason or one effort to do more, I think we will be able to ensure that everyone, everywhere, particularly people with disability, have access to water, sanitation, and hygiene. Charlotte, thank you so much for those statistics. I think for me, it is new hearing about the cost of inclusive for WASH facilities in schools being slightly lower than the normal ordinary facilities. So that's something that we normally don't think about. We just think it's costly. And even as we are planning on budget and budgeting for these activities, we leave them towards the end because we think it will be too expensive. Donors won't accept this proposal because it will look too inflated if we put in all these things. We'll add them on as we implement, we'll integrate them. But I think what would be interesting for me going forward is actually saying, because we are doing this and also catering for people with disabilities, it's actually even cheaper than doing all the other things that we have been doing, and we are actually reaching more in terms of people, including those people that would ordinarily not have access to these facilities. So I will be sure to use those figures in the next, proposal or write-up that I do on disability. That was really useful. And please do share the resources. Of course, we can also go to the World Bank website, I'm assuming, to find these resources. But if they are not easy to find, if it's easier for people to just have them here, please do share them with us so that we can be able to refer to those resources. So once again, thank you so much to everybody that has participated, to David for the opening remarks, to the three panelists, Jonas, Saleo, Kellyanne, thank you so much. I wish we had more time for the conversation, but I'm sure we can continue this conversation even offline. And this is not the last conversation that we'll definitely have. So look forward to more conversations. To Diane and to Iliam, thank you so much for those very insightful presentations. And again, I'm sure the presentations will be shared for those of us who may want to refer to your presentations. And finally, to Charlotte for closing this event off very nicely with those insights. We'll now declare, we like declaring things in the South to just make sure everybody understands that it is closed. We will now declare the event closed, but please do remember that we do have a video that we want to share with you. So if you have a few minutes, please do stay online and enjoy the video.
Rise and shine, ilangali balele. Rise and shine, lijaji lisabi ile. Before I go to my desk, I have to make sure that my wheelchair is cleaned. I will have to ask for assistance. Then I must wash my hands. I can sing a song for 20 seconds, like happy birthday to me, happy birthday to me, happy birthday to me, happy birthday to me. I have to wipe my desk. Now I can start with my school lesson. I can take out my school book. It is so difficult to be sitting so far from Wazi. But we have to practice social distancing so that we don't spread the virus. I will also wear my mask all day until I get back home.
So thank you, everyone, and bye, everyone. Bye from me.
Bye, Pamela.
Bye, everyone. Thanks.
Bye.
Thank you, everyone.
Bye.
Thank you. Bye-bye.
Bye. Thank you.
Yep.
Thank you.
Bye. Thank you.
Hi, everyone. Thank you. Thank you, Pamela, for a magnificent job. Thank you to all the panelists as well, and all the people who organised it behind the scenes as well. Fantastic. Thank you.
Yes, thanks, Louisa, for remembering everybody that worked so hard. I think things flowed very seamlessly. So thank you for the behind the scenes work.